Hi, my name is Jordan, and I'll be talking about how we updated the Circle of Health tool. So, in 2005, the University of Utah joined the National Center of Excellence in Women's Health Demonstration Project, or COEDP. They had a vision of developing a more holistic approach to women's health. One product of the work was the development of the Seven Domains of Health survey, which was used to evaluate women's health in seven domains: physical, social, emotional, intellectual, environmental, financial, and spiritual. In 2020, researchers undertook an evaluation to identify opportunities to update the survey. The survey was given to various female populations, including women participating in an issue in women's health course at the University of Utah. Based on theirs and others' feedback, it was determined that several of the tools on the survey had become outdated or were not valid, and that the language used in the survey unintentionally excluded the unique needs of women from the LGBT plus community. So in response to this valuation, one researcher performed searches for validated tools via Google Scholar and the Health Psychosocial Instrument database. Experts in the field of LGBTQ plus wellness were also consulted to identify inclusive language regarding sex and gender. The potential tools were reviewed by the entire research team, and tools were selected to update the domains. The primary search for validated tools yielded over 4,700 results. Of the results, 34 tools were included for consideration by the research team. And then in a secondary search, additional valid and common use tools were identified. And these were added to the spiritual, environmental, physical, intellectual, and financial health domains. Inclusive language was added to the survey where applicable, so added to the demographics or other domains of health where they were needed. Some of the tools chosen included the Financial Wellbeing Scale, the Princeton You Matter Wellness Self-Assessment, and the Ohio State Wellness Assessment. The new tools provide opportunities to look at women's health across the lifespan and have been commonly used or have been validated. For example, the questions from the older version of the financial health assessment on the old survey was taken in part from msmoney.com. So the tool wasn't complete, wasn't validated. The newer questions taken from the financial well-being scale provide validated questions for the financial health assessment and address different financial situations. The questions ask about long-term financial health, such as requiring the participant to rate their agreement with the phrase, "I am securing my financial future," and ask other questions dealing with short-term financial health, such as, "My finances control my life," again requiring the participants to rate their agreements. Another example is the intellectual health assessment, updated by adding the Princeton You Matter Wellness Self-Assessment. The older version of the intellectual health assessment focused mainly on measuring health literacy. However, the new version, included with the Princeton You Matter Wellness Self-Assessment, opens up the intellectual health domain to topics such as personal creativity and sharing knowledge and openness to learning. Other tools that were added to the survey benefited the different domains of health in similar ways. So it is anticipated that the changes made to the survey will improve its usefulness and usability for both women and health professionals. To evaluate its usability and usefulness, the updated survey will be presented to these stakeholders for review and feedback at a World Cafe hosted by the researchers, and it's anticipated this World Cafe will take place this summer. Thank you.